Dr. Wheat, and welcome to your OBGYN clerkship. One of the things a lot of students have concerns about when starting their clerkship is how to deal with sensitive exams like pelvic exams. So I'm going to take a few minutes today to discuss some of the challenges and some of the concerns about learning to do a pelvic exam on your OBGYN clerkship.
To me, it feels uncomfortable because I'm doing this really personal, intimate, invasive, sensitive exam on this person. I've never met them. They're not awake. I don't know if they're aware that I'm doing this. I don't know if they're okay that I'm doing this. And it just feels wrong to me because in my shoes, I would want to have the chance to consent to that and want to feel like I'm in control and not being violated.
I felt at the beginning of my OB-GYN rotation not really well prepared for what I was going to be doing, which that might be on me. But we never really talked about what the medical student was going to be doing, especially in the OR.
So one of the instances where you as a student will be helping perform or participating in pelvic exams will be in the operating room. This is a pretty typical practice that you'll see done over and over again prior to the start of a procedure.
A number of professional organizations have weighed into this issue, including the American College of Obstetricians and Gynecologists, the Association of Professors of Gynecology and Obstetrics, and the American Medical Association. Additionally, 10 states have legislated about this issue, including Maryland, Utah, New York, Delaware, California, Hawaii, Illinois, Iowa, Oregon, and Virginia.
OBGYN departments across the DoD are fully aware of ACOG's position and ACO's statements regarding pelvic exams and proper consenting. And they are dedicated to adhering to those recommendations to make sure our patients are informed and educated and properly consented before anyone participates in a pelvic exam under anesthesia.
Unfortunately, I'm running late to the OR today after morning conference. I'm not looking forward to the attending's face when she sees I'm late. I also didn't get a chance to meet the patient before surgery.
Oh, great, the medical student. How nice of you to join us. Now, go get some gloves and come do the pelvic exam.
Ma'am, I did not get a chance to meet the patient beforehand. Are you sure it's okay that I do an exam?
What are you talking about? It's a little late for that. Just go get some gloves, come do the exam.
Well, did the patient consent to medical students performing an exam ahead of time?
What are you talking about?
Ma'am, I'm really happy to be here and to help take care of this patient, but I don't feel comfortable performing an exam if the patient wasn't consented for me to do so.
You mean like, did she sign a surgery consent? Because she signed a consent for the surgery.
I don't feel comfortable performing an exam if I haven't met the patient yet.
Oh, okay, whatever. Just go scrub. We'll talk about it later.
That interaction did not go so well. I wonder what I could have done differently.
Okay, so what's the deal? Why didn't you want to do a pelvic exam?
Ma'am, I've read that some patients feel violated when medical students perform exams on them without being adequately consented. And part of my job as a medical student is to ensure that I do no harm while I'm learning. I didn't get a chance to meet the patient beforehand. I wanted to make sure that they understood that a medical student was performing an exam on them.
Okay, well, I didn't even really know that was an issue.
Oh, yes, ma'am. A number of patients have said they didn't know medical students were performing exams, and, well, they felt upset and when they were surprised to learn what had happened to them afterwards. I didn't want to perform the exam without meeting the patient first.
Well, when I was training, we had no problem doing pelvic exams, so I don't know, maybe this is some sort of millennial issue.
Thank you, ma'am, for everything you taught me during the surgery. I learned a lot during this case.
Sure, good, I'm glad.
That was a challenging conversation, but it went better than expected. I'm glad I got a chance to explain why I didn't want to do the exam.
Rather than what just happened, this situation would be ideal. Meeting patients before surgery is especially important if you're going to be doing any invasive exams. Asking permission to be a part of their team by meeting your patients is a great way to decrease their fears about medical students caring for them. Hi, Mrs. Jones. I'm Deborah Allen. I'm going to be in the operating room with you, helping to take care of you. I wanted to make sure you met me before we head back, so I'm another familiar face. As part of my training, I'm going to be assisting the surgical team in the operating room. Part of that involves performing an exam. Is that okay with you?
What do you mean by exam?
As part of your procedure, residents will be performing a pelvic exam. Similar to what happens when you get a pap smear, pelvic exams help us plan your surgery. I would also be performing a similar exam on you in the OR to help me better understand how to take care of patients. Is that okay with you?
You won't hurt me at all.
No, it won't hurt you, and the team will be instructing me the entire time.
Sure, I'm okay with that.
Great. Thank you. I will see you in the OR shortly. We will take really good care of you. I was really nervous about asking to do that exam, but my conversation with the patient went much better than anticipated.
There's a few reasons we do it. One is because sometimes we're able to perform a better exam in the operating room when the patient is comfortable and asleep and relaxed than we are in the exam room. Also, that will give us potentially more information and help us decide how we want to approach the surgery if we're not sure if that surgery can be done vaginally or if we have to do it abdominally. So by performing the exam in the operating room, we can sometimes gain more information and either help change our approach or solidify our plan for how we're going to do that surgery. Some of the things that we're always looking for, whether we're doing an exam either in the exam room or in the operating room, are things like, is the uterus enlarged? Is it normal size? Is it in the midline? Is it mobile? Is there good descent? Those are all things that we're kind of examining and looking for during the exam. And that's something that we can walk students through as we do that in the operating room.
Now, Ms. Jones, that we've reviewed all the indications for your hysterectomy, we've reviewed the risks and the benefits of the surgery. Do you have any more questions for me?
No, doctor, I think you answered all my questions.
Okay, great. There is one more thing that I do want to review with you. So, as you know, this is a teaching hospital and we have all levels of learners here, including medical students who will be a part of our surgical team and help us take care of you. Part of the surgery involves an exam under anesthesia, which is a pelvic exam once you're asleep. We have the medical students perform this exam along with the team. Are you okay with that?
Do the medical students have to perform the exam?
They don't have to perform the exam, but it does help to improve their clinical skills. It helps them to understand why we're doing the surgery in a certain way and actually builds upon their medical education.
I'm all right with the medical students and the doctors performing exams. I think it's important that the medical students learn how to be better doctors.
I think you do learn so much by watching other people, so there's some element of, because it was super unfamiliar to me and it was in an environment that was really different than anything I'd been used to before, I learned a lot just from shadowing and being close to people and just kind of seeing how it was done.
I would totally feel comfortable with medical students performing exams on me as a patient. I think maybe just because I am a medical student and so I know that I've had to learn from patients that have offered to let me do exams on them. I would absolutely let medical students learn on me as a patient, but I would appreciate being asked. I would not want it to just happen without my knowledge.